All right, let's talk about some of the most common concerns people have about GLP-1 medications and how we can address them. Because if these concerns aren't acknowledged, they can create fear, shame, or hesitation. And that can lead to people stopping too early or never starting at all. So let's go through them together one by one. Concern number one, will I gain all the weight back when I stop the medication? This is probably the number one fear, and it's a valid one. Because if someone relies on the medication alone without changing their habits, the body tends to return to its baseline. But here's the difference in this program. We're not just using the medication, we're building metabolic resilience while you're on it. That means focusing on protein intake, blood sugar balance, muscle preservation, sleep, and stress management. These are all things that determine whether your results stick, not the drug itself. We also use the lowest effective dose. In some cases, we'll even microdose to reduce dependency and make transitioning off smoother. This isn't about staying on medication forever. It's about creating an internal environment where your body can maintain results on its own. So concern number two, what about Ozempic face or sagging skin? You may have seen the headlines, people losing weight so quickly that they look gaunt, older, or notice loose skin around their face, arms, or abdomen. Rapid fat loss, especially without proper support, can absolutely lead to skin laxity. But again, this is where we do things differently. Our goal is safe and gradual fat loss, not crashing diets. We focus heavily on protein intake, strength training, hydration, and collagen support to protect your muscles and skin structure. Think of it as preserving your frame while you're shedding excess fat. Ideally, you'll be aiming for 1 to 3 pounds of weight loss per week. Concern number three, will I lose my hair? Some people do notice increased hair shedding during rapid weight loss, especially if they're not eating enough protein, calories, or micronutrients. But it's not the medication itself causing the hair loss. It's the stress on the body, the speed of weight change, and the nutritional gaps that often go unnoticed. In this program, we address all of that. We make sure that you're getting enough protein, iron, zinc, biotin, B vitamins, and support your thyroid and hormone health, which are all critical for hair growth and retention. If you've experienced hair loss with weight loss in the past, we'll build in protective strategies from the start. This is about supporting your whole system, not just chasing a number on the scale. Concern number four, will I lose muscle? Yes, you can if you're not eating enough protein or doing strength training while you're on a GLP-1. GLP-1s can suppress appetite so much that people undereat across the board. That's where muscle loss becomes a real risk. But in this program, we don't let that happen. I'm going to encourage you to aim for 25 to 30 grams of protein per meal and include resistance training in your plan, whether that's body weight workouts, weights at the gym, or home-based bands. We're building metabolism, not just shrinking the number on the scale. Concern number five, maybe you've heard people end up in the ER from GI side effects. Nausea, constipation, or bloating are common when the dose is too high, too fast, or when certain trigger foods aren't adjusted. That's why we go slow and we educate you on how to minimize these reactions. Greasy foods, alcohol, and high sugar meals tend to cause problems for some people. We'll help you spot your own patterns and modify accordingly. Most importantly, hydrate and eat slowly. The more mindful you are during meals, the less likely you are to feel discomfort. Concern number six, is this safe long term? There are always headlines. You may have read about risks like pancreatitis, thyroid cancer, or gallbladder issues. Most of these concerns come from animal studies or from individuals with pre-existing conditions. Let's address those, starting with the thyroid cancer. The warning you may have seen is based on animal studies, where very high doses of GLP-1 medications cause an increase in a rare type of cancer called medullary thyroid cancer. An increase in a rare type of cancer called medullary thyroid carcinoma. But that was in rat and mice, not in humans. Rodents have a much higher number of GLP-1 receptors in their thyroid C cells compared to humans. In a large human clinical trial, there was no clear evidence that these medications increase the risk of thyroid cancer in people. That said, out of abundance of caution, These medications are not recommended for individuals with a personal or family history of medullary thyroid carcinoma or multiple endocrine neoplasia type 2 or MEN2. And just to clarify, these medications are not associated with hypothyroidism, Hashimoto's, or other common thyroid conditions. If you have thyroid disease like many of my patients do, that is not a reason to avoid these medications. We always review these factors in your medical history before starting, and if there's any concern, we'll talk through it together. The same goes for concerns like pancreatitis or gallbladder issues. These are all rare and typically seen in people with pre-existing conditions or risk factors, which we will screen for. And remember, metabolic dysfunction itself carries serious long-term risks. Diabetes, heart disease, cognitive decline like dementia, fatty liver, cancer. The goal here is to intervene early using the safest and most strategic approach for your body. So here's the takeaway. These medications are tools, powerful ones, but we don't rely on the tool alone. We combine it with lifestyle changes that protect your metabolism, preserve your muscle, and build lasting habits that allow you to transition off without going backwards. So your action step today is to read chapter 1 in your guide and start pairing protein with every meal. That one habit alone will help stabilize your appetite, protect your muscle, and keep your energy strong. You're not here to lose weight at all costs. You're here to transform your health with clarity, with strategy, and with support. See you in the next one.